How do anatomical issues affect sleep apnea treatment? Imagine trying to breathe through a narrow straw while sleeping. That's similar to what happens when anatomical issues block your airway during sleep. These structural features play a big role in sleep apnea. When parts of your upper airway are smaller or more collapsible than normal, it makes it easier for your airway to close or narrow when you relax during sleep. For example, enlarged tonsils and adenoids are common in children and can cause significant blockage. In adults, a narrow oropharyngeal space, which is the part of your throat behind your mouth, can contribute to obstruction. Excess soft tissue around the airway, like a thick palate or large uvula, can also cause problems. If your tongue is larger or your jawbone is shorter or set back, it can push the airway into a more closed position. Obesity adds to this by increasing fat deposits around the neck and tongue, further narrowing the airway. These anatomical features directly influence how well treatments work. Continuous positive airway pressure machines, which blow pressurized air into your airway to keep it open, might need higher pressure settings if your airway is severely narrowed or collapsible. Some people find it hard to tolerate high pressure, which can limit the treatment's success. Oral devices, like mandibular advancement devices that move the lower jaw forward, work best when your anatomy allows for it. They are most effective if you have enough teeth and less severe airway narrowing. Surgical options are designed to fix specific structural problems. Removing enlarged tonsils or adenoids is common in children and often cures sleep apnea in that age group. For adults, surgeries can include reducing excess soft tissue or repositioning bones to enlarge the airway. Newer procedures involve implanting devices that stimulate nerves to keep the tongue muscles active during sleep, preventing collapse. The success of these treatments depends on the specific anatomical issues present. For example, children with enlarged tonsils usually see great results from adenodoncolectomy. Adults with craniofacial abnormalities may need more complex surgeries or combined therapies. It's also important to remember that anatomy interacts with muscle relaxation during sleep. During rapid eye movement sleep, muscles that normally keep the airway open relax, making the airway more prone to collapse if it's already narrow. Improving the airway's structure can make it easier for these muscles to do their job. In short, anatomical factors are often the main cause of airway blockage in sleep apnea. They also influence how well treatments work. Knowing your specific anatomy helps doctors choose the best approach, whether that's a machine, an oral device, or surgery, to help you breathe easier while you sleep.